Hi, my name is Carla Zanichelli. I'm a lymphedema specialist physiotherapist. I am the lead of the lymphedema clinic at University College London Hospitals. We are doing this video because not everyone will develop lymphedema after breast cancer treatment, but there is an increased risk, and there are simple things that you can do to reduce this risk. And it's important, if you develop lymphedema, that you get help early. Lymphedema is swelling that can happen in your body when your lymphatic system doesn't work, and it's a chronic condition. This means that it cannot be cured, but it can be managed.
Some cancer treatments damage the lymphatic system. The body will try to reroute fluid from the area that has been damaged, but sometimes won't succeed. If this happens, the fluid will build up in the tissue. If your body can't find an alternative way to drain the fluid, you may develop lymphedema on your arm, breast or chest area on the side where you had your cancer treatment. Imagine a busy motorway where some roadworks are taking place. If the cars are not redirected, there is going to be a traffic jam. Cancer treatments that can damage the lymphatic system include lymph node biopsy, lymph node removal and radiotherapy. In the area where fluid does not drain away, you are also at risk of a skin infection called cellulitis. This is because the immune cells that fight infections can struggle to travel as fast as they should within the lymphatic vessels. The lymphatic system is a network of vessels that help our body to drain fluid from our tissues and help us to fight infections. It starts underneath the skin and then goes deeper, forming bigger vessels, like a tree root. The fluid that our cells produce every day is placed in the tissue, and from there it enters the first lymphatic vessel. On the arms, the fluid will travel from fingers to the armpit. The chest and breast area also drains to the armpit, and from the armpit it goes to the base of the neck, where it finishes by joining a vein.
The lymphatic system helps fight infections because it's our immune system. So in the area where you're at risk of developing lymphedema, it can be that your immune cells travel not as fast as they should within the lymphatic vessels. So the problem with that is that the immune cells don't actually reach the bacteria as quickly as they should, and the bacteria has more time to do the infection on the skin. It is important that you recognize the signs and symptoms of lymphedema to get help early, to get an early treatment to prevent it getting worse and have better outcomes. So as a chronic condition, this means that it doesn't have a cure, but it can get worse, it can build up, and if you act on it when it's mild and little, it is easier than if you have more swelling.
Early signs and symptoms of lymphedema are a swelling that goes up and down slowly. Your clothes or jewellery may feel tighter than usual. You may feel heaviness, tightness, or a sensation of fullness in your arm or breast. Cellulitis, when the skin is infected, is swelling that goes up suddenly. Different to lymphedema, it is painful. The skin can be red or discoloured and hot, and you can feel generally unwell. If you notice other changes in your chest, breast and arm area, ask your healthcare team, who will be able to assess the issues and make appropriate referrals. If you think you might have lymphedema, please contact your doctor, nurse or allied health professional, and they will refer you to your local lymphedema service to be assessed. After a medical check, your doctor may prescribe a course of antibiotics if needed. It's important you take them for the full time they tell you to. 2 weeks is normally recommended. You can also contact the Lymphedema Support Network, the charity who supports patients who have or are at risk of lymphedema.
My name is Trisha Mitchell-Edwards. I am a breast cancer nurse practitioner and I work at the Royal Free Hampstead. If a patient thinks they have developed lymphedema, it is important that you contact your breast clinical nurse specialist as soon as possible, so you could be appropriately triaged and referred to the treatment center. It is important to act quickly because Lymphedema can be debilitating. If left untreated, your arm could become swollen, and that swelling can become very uncomfortable and restrictive.
If you suspect that you have an infection, cellulitis, you need to be assessed by a doctor as soon as possible. Please contact your GP surgery or breast care team immediately.
The three things that we know that can decrease the risk of developing lymphedema is skincare, because it prevents getting cellulitis, movement or exercises, because you are helping with the muscle pump, the drainage goes better, and maintaining your body weight under normal limits, because obesity is linked to higher risk of developing lymphedema.
Skincare is important for lymphedema, particularly to reduce the risk of getting cellulitis. Bacteria that cause infection will find it easier to enter the skin if there is a break in it. Some examples of good skincare include regularly moisturising the skin where you are at risk of lymphedema, treating any skin problems if you have one, wearing gloves to protect the skin from scratches when doing gardening or other activities, and applying sun cream when spending time outside. If you do damage your skin at the site of where you are at risk of lymphedema, wash the area with soap and water. Keep an eye on the area to check it heals and to spot any early signs of infection.
The precautions one can take to reduce the risk of lymphedema is to wear protective clothing. This may include gloves, when you're doing gardening, for example, or cutting vegetables when you're preparing a meal. We would also say if you have to go away to hot countries, insect repellents are important to use.
Doing exercise and keeping active is important following breast cancer treatment. Muscles help the lymphatic system to drain, so moving the area where you are at risk of lymphedema will promote drainage. Any exercise will help. This could be a sport you enjoy doing or doing exercises at home. If you have any concerns with mobility, particularly your arm and shoulder, ask your GP or breast care team before starting any exercise. They may refer you to a physiotherapist.
My name's Carolyn and I live in Camden. I was diagnosed with lobular breast cancer just at the start of the lockdown in March 2020. The advice I would have regarding exercise is that just loads is known about how helpful it is after a cancer diagnosis. Doesn't matter what you did before, what we know is that exercise can help with all of the side effects. One way or another, all of the side effects of treatment are a little better, a little eased, if we're able to be active afterwards. I have what's called mild lymphedema, which is a little bit of swelling around here. And the thing that I learned that was really empowering was I've learned how to massage it myself. It's made a big difference because I can self-advocate. I know how to move fluid that's no longer draining from where my surgery was. I know how to gently move it out of the way and deal with it that way. I learnt mine from a cancer specialist physiotherapist, but if you talk to your oncology team, they can refer you to a lymphedema specialist on the NHS.
Being overweight or obese puts you at a higher risk of developing lymphedema, so maintaining your weight within healthy limits is recommended, maintaining a body mass index, BMI, of less than 25. If you need to lose weight and need some help, you can contact your GP, who can refer you to a weight management program or dietitian.
For me, it's been about supporting my energy levels, a little bit about weight management, but for me, I've focused on eating well, looking after my gut, looking after lots of fruit and veg, and good protein.
It's good that you actually lift weights, but if you're not used to it, we always recommend that you build up your strength. So you start with light weights and you build it up. Flying on a plane, we recommend you to move, to actually use your muscles to help the drainage. The good news is that you can still fly to go on holidays, and please keep living your life as normal as possible. With sauna, some people swell up when there is hot temperature, but not everyone. So what we would recommend, going to the sauna for a few minutes and see how your arm and your breast behaves. If not a problem, then you increase the minutes going into it.
You can usually have your blood pressure and blood test done on the arm on the same side as you had your breast cancer treatment. Recent research has found no clear link between the procedures and developing lymphedema. If you feel worried, you can ask for them to be done on the other arm instead. For more information about lymphedema, you can access the Lymphedema Support Network website or give them a call if you feel that talking to someone will help you more.
To finish, my advice as a specialist would be to continue living your life naturally. Try to be proactive with the 3 things that you can do to reduce the risk of getting lymphedema, and please get help as soon as possible.
After breast cancer treatment, it is important to remember that the treatments we offer these days actually reduces the risk of developing the condition. If you do develop it, this is treatable. As soon as you report it, early treatment means a better outcome.